Okay, we're going live. We're going live. Okay, so we're waiting for people to join.
You're so good with all this technology.
Okay, I just spent 20 minutes with Vadim, and Vadim is in the hospital, and he's like, I can't be testing this for you anymore. Okay.
I know, I even wore my shirt.
Inhale, exhale. Awesome. Okay, so guys, I know one person joined so far, so we connected a little bit earlier to test the connection and everything. We're gonna wait for everybody to get together.
Wonderful. I have, let's see. There's someone that's gonna. There's someone that's going to be requesting to join the Facebook.
Just tell me if you see both me and Andrea and if the sound quality is good. Okay, oh, we start getting some people. Great. Okay, guys, it's 10 a.m., so we're going to get started. We're still waiting for a couple more people to join. We were supposed to talk about breath today, and we will a little bit, but we want to address a little bit current situation. I know people is nervous. I personally got COVID right before the Christmas, and everybody in my family got positive, and I didn't get to go on my cruise, and the cases are ramping up. And Dr. Espinoza, she is here with us today, and she's my personal hero because I called her yesterday to discuss all of the detail, and she was so sick with fever and multiple other symptoms that I think she will tell you about. And we just want to address a little bit the current situation to release everybody anxiety, and that's a lot of unknown, and we want to talk about what we are doing to ourselves and our families with this COVID, and something that you might possibly use you know, for your own benefits. And it's a lot of questions that unanswered, and I know it's a lot of anxiety about nobody trusts CDC, but the truth is nobody knows anything, and CDC is just giving whatever they have. And you know, you go to the physicians, and we as physicians, we don't know too much too. So we want to first talk about a little bit current situation with the Omicron, and what's going on, how we feel about it, and possibly give you some advice. So we welcome any questions you have, and then we'll see how it goes and how Dr. Espinoza feels, and maybe she will be gracious enough to talk about breast too today, or maybe we will reschedule this. Okay, so I'm gonna give floor to this wonderful physician. She is board certified pulmonologist, pulmonary and critical care, so lung doctor, very important in current COVID situation. And she's also mother of 3. She practiced traditional medicine, she practiced holistic medicine, and she is my hero for even joining us today with being so sick. So please, warm welcome to my very good friend and a colleague and partner in traditional and holistic approach to medicine, Dr. Espinoza.
Oh, thank you, Dr. Nimkovich. You are my hero and very motivating. So anyone who knows Oksana knows that she is just a positive light in this world. And so she's right. Yes, we were supposed to be in the studio today recording live, but things happened, and over the last 24 hours I developed I think it's the flu, but you know, at this point, like we're going to touch on, it can be just about anything. And I know we'll delve into some of the COVID situations, but yes, we were supposed to discuss and review this book called Breath by James Nestor, which is an unbelievable read for anyone who has audiobook capabilities. James Nestor went and took almost a decade of his life to really break down and research the elements and physiology and importance of proper breathing. So now that we're into our almost 2-year mark of this pandemic and trying to discern what are the true treatments for respiratory insufficiency before, during, and after COVID, what does that look like? I guess I wanted to kind of tie in some of the things that I've done with some of my patients over the last 6 months, which is an old, very old traditional breathing method called Qigong, which is in the spectrum of Tai Chi. And when we really take the time to think about how our body heals, how we get that very important element of oxygen, not just to our lungs, but obviously to the tissues, it takes a lot more focus than we think. So one of the things that I guess I've learned over the years and the impact of reading this book was such that it was like many aha moments, because I spent most of my career literally watching people breathe either on the ventilator or in pulmonary clinic, and realizing that most of us don't breathe properly. We, when we're anxious or when we're overwhelmed or when we're carrying things, a lot of times we'll take very short, choppy breaths. When we're talking about breathing and inability to do so, and Oksana, I know you mentioned the 3 kids. I didn't know what shortness of breath was until I was probably 10 months pregnant with our first child. And then you realize that, hey, the diaphragm has nowhere to go. And the importance of the diaphragm being able to descend and properly fill those lungs becomes compromised during that time. Imagine having to do that every day, whether you have asthma or COPD or, you know, some of the more involved diagnoses like cystic fibrosis. And now we're seeing people who have no history of breathing abnormalities, and they're, you know, hit with this virus, and subsequent to that have chronic persistent cough or chronic fatigue, chronic shortness of breath. It takes the entire body in order to participate in the respiratory mechanics. So one of the things that I've asked patients to do, and we can all do this, is if you've been to my exam room, it's completely mirrored for the most part. And so what we do is we add, and that's where we do the Qigong as well, is I ask patients to take a deep breath. And if everyone takes a deep breath right now, most of us, if we're not thinking about it, this is how we take a deep breath, right? We lift with our shoulders, which is counterintuitive to what we need to do with our lungs. So what we should be doing is we should be watching our belly button. And we should be watching our belly button go out when we inhale and go back in towards our spine when we exhale. So it's kind of like kind of wringing out a dish towel when we exhale. And exhalation is such an important part of breath work, because if you think about it, we're getting all the good oxygen in through our nose, and then we should be getting the CO2 out. And a lot of times we say it should be at least a 1 to 3. So if we take 1 second to inhale, we should take about 2 to 3 seconds to exhale. And for some of us with obstructive lung diseases, that will be a little bit more during exhalation. But the other thing is to remember that does it matter how we breathe? Does it matter if we're mouth breathers or nose breathers? And can we change that habit? The answer is yes, it matters. And yes, we can change the habits. If we're talking about oxygen and the healing parameters of oxygen, we need to breathe through our nose. We get 19% more oxygen component to our breath when we breathe through our nose as opposed to our mouth. And we can actually structurally change the Nair's anatomy just by simply reminding ourselves to breathe through our nose. So when we talk about things like the flu or COVID, and we're having shortness of breath symptoms, what should we be focusing on? Yes, there is obviously the need sometimes for inhalers. Yes, there is the need sometimes for nebulizer treatment. But one of the most important things that we could also do is capitalize on the times. And Oksana, you mentioned this when you had your episode in clinic, and hopefully you'll expand on that, is steam and just getting your airways from the respiratory system starts at the tip of the nose. So we can affect the lower bronchial tubes, and we can affect the alveoli that participate in oxygen exchange simply by opening them up and dilating them. So there are a lot of essential oils like eucalyptus and peppermint, and you see all these little shower steamers now. You can throw one of those into your shower in your tub, and it's amazing how it will actually open up the airways. You know, we used to do this with children before we had all these new, you know, technology and inhalers and nebulizer machines. That's, you know, what I call it the way back when treatment used to be, you know, steam showers or steam baths for the little ones. There are, you know, there's a tremendous amount of post-COVID bronchiolitis or post-COVID asthma that's developing now. And if you think about asthma, it's an inability to, it's not so much a problem getting air in, it's a problem getting air out. And then we stack all that old stale air and we're not able to, you know, get it all out so that we can then allow that diaphragm again to descend properly. So again, if you really try, you should put your hand on your abdomen and you should really try to take deep breaths without moving your shoulders and breathing through your nose. And it's not something that comes easily to most of us. And I'm not sure, Oksana, if you want to, you know, touch on the importance of, you know,
I actually want you to elaborate a little bit on the difference between how men versus how women use belly breathing technique, and also like what is the difference it make when we breathe with our shoulders and just recruiting upper portion of lungs versus when we expand and use the whole lungs. Can you elaborate a little bit more on two of those questions? So men versus
right.
women, and upper lungs versus lower lungs.
Right. So women, we know when we're not in that state of, you know, gravida or expecting a child, usually we already are born with a little bit more limitations to what we call thoracic excursion, simply because we have these things called breasts, and some of us are more endowed than others. But there's been a certain amount of patients that I've even had to send for breast reduction surgery simply because they do not have the thoracic capabilities to open up their chest as much as they would like. So, you know, and there are certain hormones that can affect, obviously, the tenacity for the muscles around the airways to be more, you know, we talk about the estrogens and whatnot that can affect those bronchial muscles. But I guess specifically, is that kind of what you're, she asked hard questions.
Yes.
Yeah, pretty much. Right. And so just she's very smart. So that's one of the things, is to remember that, you know, we have to work a little bit harder. And you know, one of the things in the book that shocked me was it's just phenomenal science to me that if we lose 10 pounds of weight, 8 of those pounds are typically lost from breathing, meaning we exhale off more. So to turn that around, early in my practice, you know, we get these things like the pink puffer and the blue bloater, and there's these amazing, you know, Netter and anatomy books that, you know, has these visuals of this. But I wondered why is it that people with end-stage COPD or emphysema, why do some of them, they're just so thin? It's not that they have cancer. It's not that they don't eat. They eat. It's just that when I see my patients losing weight, and it's not from a cancer reason, it's typically because they're in a worsened state of obstructive disease, meaning they're breathing off all their calories. So it's not uncommon for me, as we get the patients on good therapy, as we get them to breathing better, as we decrease some of the anxiety relating to breathlessness, that they actually start gaining a few pounds. And I say, well, it's good because you're not actually burning off of your calories to breathe. And when I read this in the book, it was, again, a light bulb moment, like, hey, there is actual truth to this. There is data, there is physiology to that. So when we breathe as women, who wouldn't like to lose 8 pounds, right? But if we take our time to properly breathe, and it's not, you know, it's difficult to breathe when we're sitting. It's easier to breathe, obviously, when we're standing, and it's a little bit challenging to breathe when we're lying down. But if we think about all of those positions, we can maximize on it if we just focus on what are we trying to accomplish. We're trying to accomplish moving that diaphragm as low into our pelvis as possible. So again, focus on the belly button, putting your hand on the belly button, your lower abdomen, and try to see if your hand moves out. And so when you take a deep breath through your nose, you shouldn't really see anything moving with your shoulders, right? Same goes when we're doing stretching, as Dr. Nimkovich does so amazingly every week and shares these with this group. I mean, if you watch her, 99% of what she's talking about and doing is breath work and breath exercises and moving the flow. So we call qi in Chinese means energy. So when we do things like qigong, we're actually trying to move the energy and the breath, which are one and one and continuous through the body, so that we're getting ample perfusion. So when we talk about things like being ill or being sick, you know, in the ICU, it's all about volume. Are we moving this volume of good, healthy, oxygenated blood to the tissues that need it? And it should not always come in the form of just dumping in fluids. A lot of what we did with the mechanics of the ventilator actually helps the heart or the cardiogenic potential and function during those very, you know, scary and intense medical situations. So, and then the second point that you asked, the second question, I've already. So the one was men and women, and the second was
men and women, and then upper respiratory airway versus involving all of the lungs. But let me just, for a second, I love that you mentioned how weight loss and breathing is connected, because as like a medicine doctor, I always wondered about physiology. Okay, well, you lose 10 pounds of fat. Where does it go? Do you poop it out? And physiologically, you can't poop out your weight, okay? Do you pee it out? Does kidney clear? But no, like kidneys don't remove fat from your body. So where does it go? Where it melts? Does it become water? And like from biochemistry standpoint, no, it does not become water. It's actually become water and CO2. And CO2 this is what your lungs remove. So nowadays, when I'm talking about weight loss, breathing technique is one of the most important stones. I talk about breathing before I talk about any other type of exercise, and people who did my weight loss program, you know, guys, what I'm talking about. I made all of you do Fukushima method, and I have a video on YouTube, but basically Fukushima method, this is where you lying down, and you mentioned that to breathe when you're lying down is like the hardest way. So you lying down and you put book or like anything heavy, about 1 to 2 pounds, on your belly button, and all you do is on the inhale you make sure the book is rising, and on the exhale you make sure the book is falling down, so the belly button moves. And this is how you train and you retrain your body to actually use your belly and diaphragm. And this is when you come to my weight loss clinic. This is week number 2. I make you do, before you go to sleep, 30 of this every single day. And it's specifically to retrain you the way to breathe for the weight loss. And you all know how it works. And, you know, the guys who did my program, you know, the first thing you do is like the waistline slims down just because you start using and exercising these muscles. You mentioned Qigong class. Can you tell everybody, if anybody want to come and join your Qigong class, how do they do it?
Yes, it is. It's free. It's open to anyone. You just call the clinic and let them know that you're interested. You bring yourself and a water bottle. We don't even say comfortable shoes. You can bring, you know, yoga socks if you want. We moved it from upstairs, the healing studio, to downstairs for some of our patients that had some limitations climbing the stairs. But what it is, it's really an amazing opportunity to learn both ways. I learn from my patients all the time. Hopefully they learn something from me, but you can do it sitting, you can do it standing. And what we do is we do a lot of movements that seem to be just, they're just flowing and they're just relaxing. And we use the Lee Holden method, and it's a lot of upper body, right? Because when we talk about all the muscles that we need to breathe, if we wear out the shoulder muscles and the upper muscles, upper neck muscles, just breathing like this, a lot of the other muscles actually become a little bit atrophied. And then when we need to bring them in, when we're having a respiratory event or a pneumonia or something, God forbid, then we're just kind of limited there. But if we're able to really teach our bodies again how to move that upper body and how to move that breath and do that breath work in and out, but in a way that seems comfortable. I don't know about a lot of people, but you know, things can be very challenging. So you can't tell me right now, let's go train for a marathon. It would have to take a lot of preparation. If you ask me to go to CrossFit, even yoga can be very challenging, but Qigong, I say it's something, it's as much for the mind and the breath as it is for the physical body movement. And then it just gets everything. And honestly, doing Qigong has probably helped me do yoga better every morning, because I'm able to remember that I need to breathe when I'm holding these motions. And it's a very difficult thing. And I ask patients, sometimes I'll have 2-pound weights in my clinic and hold one in each hand. And I ask them, pretend you're lifting your grocery bags and you're walking from point A to point B. Because a lot of patients I noticed in my career, they say, yeah, I get short of breath when I'm carrying things and walking. Well, the reason why, if you really pay attention, a lot of us, when we carry something, we don't breathe. We just don't breathe. We're anticipating something. And then once that circle starts of, I'm short of breath and I'm getting a little anxious because I'm short of breath, then I get more anxious because I'm short of breath. And then we just get caught in this cycle. And what do? We stop doing those things that make us short of breath. So we stop training those muscles. And then it's a ongoing cycle. So we do it 9 o'clock every Friday, unless, it's a holiday, or like today that, I potentially can, get other people sick. We're obviously working remotely here today. But hopefully in the near future, we'll even have, like an online version where anyone and everyone can participate. But there are a couple of moves that, a few moves that we practice every session. And, because it's to coordinate your breath and your upper body movement can be a lot sometimes. So one of the things we talk about doing, and I can try to maybe see if I can demonstrate it here in a second, but it's in the morning we get up and we should all make our bed and smooth it out. We should all, if we're getting our clothes out of the cabinet or chifforobe, as we used to call it, we should close the doors, and then we should open the windows and let the light in. So that's a simple movement that I do every morning, and I encourage the children to do every morning. So I'm going to try to see if I can move this here so we can see. Let's see. Okay. So what we do is we wake up in the morning, we make our bed, and after you make your bed, most of us, we smooth out, right? And so we smooth out the sheets. So we take a deep breath in and then out. And then we close the chifforobe. And then we open the curtains. So it's simple. It seems very simple. But after we do this about 5 times, you can already feel kind of your body shifting and your muscles getting a little, like recruiting your muscles a bit. And it's something very simple to remember. Lee Holden has his, I think he calls it the tiger movement. It's a little difficult sometimes to remember, but if you think about your routines and your daily habits that you do, these are the things that are important, right? Getting up, making the bed, getting up at a certain time, working with the sun and your circadian rhythm, literally getting ready, and getting yourself dressed for the day. And then opening up the sunlight, making sure that we're in tune and aligned with the natural sunlight and the vitamin D that we need, which is extremely important and critical during these times of, pandemics and virus and whatnot. So, I mean, those are just some of the things we try to make it very, and it should be very engaging and something easy to remember. And one of the things actually that I was going to share, and I could definitely have this, if you wanted to post the article, this was an article that was put out in last year on August of we're in 2022, August of 2020. And it's about Qigong for the prevention, treatment, and rehabilitation of COVID-19 infection in older adults. And so I always say, what we can learn from our elders can absolutely be applicable to us here and now. And so it goes through the maneuvers of breathing and breath work and upper body movement that's actually essential in the recoverable potential and rehab post-COVID. So we can, get that and share that link with you all. But, Oksana and I were just talking this morning about, okay, what are some other things that we could be and should be touching on now for both prevention and treatment? And I'll give the floor back to you.
So what we talk, because whole my family got COVID, and my kids and my husband and like the rest of the family. The only person who didn't get sick in my family is my 88-year-old grandmother, who is phenomenal. So we were talking about what can we do, and we talk about a couple of things. Number one, we talk about vitamin D. Of course, you have to talk with your physician, because vitamin D is not always good for you. You can actually develop side effect like hypercalcemia. So you should have been checking your vitamin D level at least yearly. But if you don't have contraindication, vitamin D actually proven and showed very beneficial effects in the COVID and post-COVID recovery and an immune response. We talked about vitamin C, and I'm a big proponent of vitamin C in acute condition. Long term, it can actually cause a kidney stones, but Dr. Espinoza mentioned that vitamin C causes a lot of GI upset symptoms for you. So again, it's something that you can use, but you always have to listen to the body. And if you are feeling that this is something that making more harm than good, then of course it's not for you. Also, if you're somebody who ever had a kidney stones, I will think 5 times before putting you on any supplemental vitamin C. But supplemental vitamin C in the pills, it's not the cornerstone. I actually recommend natural sources of vitamin C, like bell peppers, like lemon, like citrus fruits, and maybe you would feel better than actually taking vitamin C supplements. Dr. Espinoza also taught me about monolaurin. Can you talk about monolaurin? I take monolaurin now for like 2 weeks already. So
absolutely. So at the beginning of the pandemic, I have a very dear friend who's a functional medicine specialist. And he basically, there you go. And it's the 500 milligrams there. And so there you go. And so what he talked to us about was, because he likes to kind of break things down to a very chemical and scientific level. He talked to us about a natural component that's found in as a coconut extract, Monolaurin, and it has antiviral potential in the way of preventing the virus from gaining intracellular access. And so it's not a quote treatment, but it definitely aids and helps your body and your immune system to try to fend off the burden of the viral replication, right? And so I don't know how much you take.
I take 500 milligrams twice a day.
Twice a day, yeah, that's what we say. And really that's the acceptable dose. And then for maintenance, if you're in a situation where you're either having to be the primary caregiver of other people, but you're not absolutely affected yourself, meaning like you're not symptomatic yourself, usually what I will say, we've been taking 500 milligrams daily as just kind of preventative. But interestingly, I stopped that about, I guess, a month and a half ago. I'm not sure why, but now I restarted at 500 milligrams twice a day now that I'm symptomatic. And again, not knowing if this is the flu or COVID. But then one of the other things is, and I know they are actually doing some studies and on the utility of Monolaurin. You can Google it and you can read about it. A lot of pretty valid observational studies out there. The other thing is, when COVID first hit, my father-in-law, who was the chief of rheumatology at LSU, he and I were sitting out at a family meal, and some of his fellows all over the world were asking him about this new drug that had come out and whether or not the utility in COVID, especially for their autoimmune patients, would be beneficial. And the medication was Actemra, which was an anti-IL-6 drug. And so he and I got to talking about the fact that one of the most potent anti-IL-6 in nature is actually turmeric, which is a spice, and curcumin, which is the active agent in that, is actually a very potent anti-inflammatory agent. And so I know a lot of people out there are taking, turmeric tablets and supplements and whatnot, but I'll just encourage, we have, and teas are an amazing way to open up the airways and to really get that bioavailability of whatever kind of supplement that you're putting in. That's why we say try to get your supplements as naturally as possible, right? If you can avoid taking a pill, which is another burden on the GI tract. So turmeric tea is something that I take every day. If you can get the kind that has the black pepper component to it, that actually adds to better absorption in the body and the GI tract. But if that's all you have is to take a turmeric, supplement tablet, then that's good as well. But it's a very, very important, in my opinion, additive to your daily regimen, especially during those times where you're feeling a little under the weather.
And then there is a lot of natural products that known through the ages for antiviral properties, like garlic. So, if you, especially if you quarantine and you don't have to go and meet and talk to other people, like include as much garlic as you possibly can. We also talked about ginger and lemon and honey, which is anti-inflammatory and immune boosting property. And you can make it as the drink, like you can have a tea. Remember, honey is actually being deactivated by boiling water. So you want to add honey into warm, not super hot or boiling water. But you can do ginger and lemon, put boiling water over it, wait until it cools a little bit, then add a little bit of honey to it. And then another thing that we talked about is actually COVID causing a lot of thrombotic events. And we see even a couple weeks after people developing clots in the legs, in the lungs. And people are so sick that a lot of the time it's actually getting undiagnosed because we're treating other conditions and we're missing these clots. And it actually was a lot of mortality, a lot of deaths because of the thrombotic events. So we were discussing, and again, it's not something that is scientifically proven and medical community recommends. It's something that is up for discussion. So it's a use of aspirin, baby aspirin, 81 milligrams. I recommend to, especially my senior patients, to take 81 milligram of aspirin for at least 6 weeks after COVID. I don't know, Dr. Espinoza, what do you do? What have you thought about? And my second question, aspirin and vitamin E, because vitamin E also known to thin the blood and prolong the bleeding time in some populations. So what do you think about vitamin E supplements and aspirin supplements during and after COVID?
That's a great question. So we did recommend that kind of when we were in the heart of the worst of the worst from a respiratory standpoint. Omicron, as you mentioned, is a little bit different. We're not actually seeing as much of the thromboembolic events, but you don't know what the long-term sequelae is. But I think if you have, first of all, to check your med list and make sure there's no, counter interaction and you're not on anything that would propagate bleeding. And then the baby aspirin at 81 milligrams really is not, there's very few people that are going to tell you that it's dangerous to take daily, especially if it's for a very short amount of time. I think 4 weeks is is a good sweet spot to do. The other thing is, we talked about this earlier today, is to augment with anything that you're taking, supplement or medication, with something physical. So meaning stretching. Like yesterday when I was down and out, I made it a point to make sure that I'm moving, that I'm stretching, that I'm, engaging especially the lower body and lower extremities, the calf muscles, to prevent any type of kind of stagnant blood flow. So whatever it is that you're going to take, baby aspirin 81 milligrams a day, which I do lean to if you've gotten to the point where, especially if this has a strong respiratory component to it, to do that. Because as Dr. Nimkovich mentioned, it's not so much, okay, I'm going to, diagnose clots in the lower extremities, but those clots come from somewhere to the lungs. So when you're having those respiratory symptoms, a lot of times it's just COVID. It's just COVID. And as she mentioned, if you don't look for it, then that's when we have these massive pulmonary clot burden that can have if you find it and it's actually treatable for that time, can still have long-term effects on the cardiac health. So baby aspirin 4 weeks, I think 4 to 6 weeks is a healthy time, but at least 4 weeks. and then just movement, making sure that you're stretching and keeping active, because the sick complex and the sick component, you know, we have a bigger control of that than we think. And I don't want to just say the hallmark mind over matter, but if you look at a lot of, you know, Eastern medicine and whatnot, it a lot of it is, you know, getting out there and sweating and moving and pushing your body. Because sometimes when we get into the habit of saying, well, I'm sick, I can't move, I need to lay on the sofa and eat ice cream and watch TV all day, we're not really doing anything for our immune system. We're not really doing anything for healing in that regard. We're actually setting ourselves back a bit. So just getting up and trying as much as you can to try to work through it a little bit as well. That's why,
But even not just
so that's
getting
why,
up, even if you not get up, you move your toes up and down, you
yes,
bring your knees in and out, you elevate your legs, and like everything that makes blood to move a little bit is going to be very beneficial in preventing any clot formation. Guys, I want to remind you that the
absolutely.
reason we're doing live session, because we want to interact with you. So if you want to ask us any question, I am monitoring the chat and we will be happy to answer any question of yours. But Dr. Espinoza, I want to come back when you were talking about the nasal breathing, and you mentioned something very briefly. You can actually retrain yourself and even change anatomy. And I know a lot of people
Yes.
have like septal deviation, and we talked about with you how the shape of palate and even our teeth change with incorrect breathing, and it's actually a reversible thing. So I really
Yes.
want you to talk a little bit more about this, because when I learned it from you, I was like, yes, we can do something about this. So I was so fascinated.
Absolutely. So it's so yes, so so one of the, and again, I'm big into like facts, like, oh my goodness, I did not know that. Like, but I did not realize until you start looking at a lot of nature or animal pictures that humans really are one of the only mammals that do not have have the need for, I'm sorry, like orthodontics or braces, right? And so if you look at, you know, even fish, if you look at the oral anatomy of most animals, a lot of them don't have crooked teeth and most of them don't snore. And so, you know, what we've done with either how we're eating, how we're enabling, I should say, our babies, even when they breathe at night when they're younger and they're small. And, you know, I could dive down into the whole dairy and nasal congestion and edema and whatnot with that, airway inflammation. But a lot of the things that we're feeding the babies when they're small and they come into the world can actually have an impact on their capacity to breathe through their nose, which is why they start breathing through their mouth in the first place. And so you'll start seeing a lot more, you know, babies with, you know, tonsillitis, and we have cavities and we have poor dentition, and there's a lot of things. The air should travel through those nice nasal passages that are primed and ready to filter out a lot of the things that our respiratory tract should not be seeing. And so, yes, the elongated faces, and there were, you know, fortunately or unfortunately, I think unfortunately, it's sad that it had to give the point, but there were studies done on, you know, primates doing, you know, both nasal, you know, obstruction and having them breathe through their mouth in the shape of their faces, and then reversing it and, you know, almost kind of shutting the mouth and having them breathe only through the nose. And you can actually see, as you said, Oksana, that the physical anatomy of the face changed in these primates, and it actually happens in humans as well. And so James Nestor actually did his own sort of experiment, if you will, on himself, and they measured, you know, he and his Dr. Olson got basically were able to feel and see the difference in their sleep patterns, in their daytime energy levels, in their metabolism, in their blood pressure, by simply breathing through the nose as opposed through the mouth during the day, as well as obviously during sleep as well. And so it's I can't do it justice with how, you know, the details of what he goes into. I do, like I said, highly recommend to pick up the book, pick up the audio book and take a listen to it. But I mean, if you think about a lot of the things that we contend with children when they're small, a lot of the reasons we are going back and forth to the dentist or to the orthodontist or to the ENT has a lot to do with the anatomy in the head and neck region. And so, it would be extremely interesting to get input from an orthodontist or an ENT and just kind of see their thoughts on it. Because it's ubiquitous. So many people, including myself right now, has, braces, and it's one of those things that I think we can make an impact with if we just kind of start thinking and starting with the children.
I remember you mentioned before, Dr. Espinoza, by the way, also does sleep studies and treats sleep apnea. And I remember you mentioned to me before that some of your patients are actually being referred to you by orthodontists that suspect sleep apnea just from the way the mouth look, the way the teeth look, and orthodontists refer the patient to you because they suspect with whatever they're seeing in the mouth, they suspect that patient already have a sleep apnea.
Absolutely. And it's good that we're working together. And I will tell my patients, even the ones that we do a sleep study on, and we start and initiate CPAPs, which not everyone wants to have a CPAP forever. But if we use it as a temporary maneuver to get that sleep-wake cycle back where it needs to be, to get efficient sleep, as we're doing other things like making sure that we're having proper sleep hygiene, that if we need to elevate the head of the bed in order to move that lower jaw, forward to amplify how much can actually get through the nasal cavity and beyond. There are a lot of things that we can be doing, but in the interim, especially in our patients who may have a cardiac predisposition to, cardiac disease or renal insufficiency, if we can get them through a period where they're getting good augmented sleep and good augmented blood flow to those organs at night with a CPAP, I think that's definitely necessary. But I do encourage patients to embrace the idea of possibly working through that and eventually maybe even liberating themselves off of that. And that can be done, but it takes some work to do. But yeah, it's an interesting, and the backstory to that is coming through fellowship, I was all about the ICU and critical care and saving lives and this, that, and the other. And I started noticing that a lot of the comorbidities that I was seeing in the ICU stemmed from undiagnosed or unrecognized or untreated and known sleep apnea. So a lot of the patients who had, and if you look at sleep apnea, the importance of it is that, Oksana, if I had a heart attack yesterday and you've never had a heart attack, but you have sleep apnea, we are both at the same risk of having a heart attack tomorrow. So it's that important that we look at hypertension, inability to lose weight, mood swings, chronic headaches, migraines, diabetes. The link between diabetes and sleep apnea is so important. And I think if we really are thinking about the poor oxygenation of our organs, I mean, the liver, pancreas, the kidneys, these are our powerhouses. These are the ones that affect the clearance of all of these toxins and also help us break down what we're putting into our body. So I think I embrace and thank and welcome providers like you who think outside of just that one organ and say it's all connected. So it's and I'm still shocked when someone comes in and says, I think I have sleep apnea, and I'm like, well, tell me. And then and it's almost like textbook, but we don't think about it a lot because snoring has become something that socially, it's almost like comical. Oh, such and such snores. And to me, when I hear that, I'm like, I even, there's some people I hear, they're sleeping in different rooms, and that's not good. That's, it affects so much. The downstream impact of poor sleep, or what we call sleep disordered breathing, is just not worth it. Whether you're 50 years old and you're having a heart attack or a stroke, and oh, by the way, when you were hospitalized for that stroke and heart attack, the nurses realize you stop breathing sometimes at night. Well, that's not good. That has to be addressed. So snoring, I think, has to take a bigger step forward in what we do and perceive as just acceptable in society, or something that is trying to scream, get yourself checked for sleep apnea.
Absolutely. And I want to kind of like go to a little bit, you know, I'm a very practical person. So if you guys watching, I want you to get benefit immediately and today. So I'm going to share two of my favorite techniques that I use with my patient. And I'm going to ask Dr. Espinoza to share two of her favorite techniques. So my number one, and I try, so when I listen, when I examine patient in my office and I listen to the lungs, and I've noticed that, you know, their shoulders are moving, okay, and then I don't actually hear the bottom part of the lungs because of the posture, because everything is so collapsed that those part of the lungs are not included at all. So I use I send my patients from my office to Dollar Tree to buy the pack of the party balloons. And I told them to use one balloon per week. And the goal is to inflate balloon 20 times per day, not like all together, but throughout the day. And I asked them to, when they inhale, they imagine that each lung is expanding like that balloon, and then they blowing into balloon as long as they possibly can in one breath. And I asked them to specifically watch as the exhalation increases and how much of the balloon they can blow and how it's increased. So for example, like you inhale and then you blowing into balloon, and on the day one, with one breath, your balloon only expand to this. But then as you see at the day 10, you can actually inflate balloon that much. And it shows you your lung capacity. It shows you how much air you can hold in one breath and how you improve it. And people are fascinating because they see immediate, almost like 3 days into that, they see the result, the balloon is getting bigger, and it's so visual, and it incorporates your mental think about, I am actually changing it right now, and this is my lung capacity, and this is how much air I can hold in my lungs. So balloon technique is my favorite technique, and it's so simple, and it costs you nothing, and it's actually bring joy to small kids in the family, because grandmother or mother or grandpa is inflating balloons now, okay? So this is my number one. Number two, and I found it is most beneficial for myself, and I ask selfish questions. When I ask you about septal deviation, it's because I myself was diagnosed with a septal deviation, and you know, all of you know, I do a lot of yoga, and left nostril breathing technique is so important in yoga because it's actually activate the right side of your brain, which just calms you down, and it's more artistic, and it's more not practical, just like slower your emotion. And I could never do this because my left nostril never breathe this, okay? And so I am doing, my favorite technique is, it's alternative nostril technique before I can do my left nostril. And after the year of doing alternating nostril techniques, I can proudly tell you that I can now do 5 minutes of left nostril breathing. Year ago, it was impossible for me. I would suffocate after like 20 seconds. Okay, so, and I just got, I wasn't able to inhale the full length with just my left nostril. So the way, before I am able to do left nostril, the way I'm doing my alternative nostril breathing. So I would inhale through both. Then I would close one, exhale through the left. Then inhale through the left, switch my fingers, exhale through the right. Inhale through the right, close right, exhale through the left. Inhale through the left, close, exhale through the right. Inhale through the right, close. And I would set myself up and time myself for 5 minutes. And after I was able to retrain and my left nostril finally open and pop up, now I can do technique with just the left nostril breathing for 5 minutes. I swear to you, I'm teaching yoga from 1999, and I was not able to do it up until about a year ago, and I'm finally able to do this. So you can change your anatomy. I was born with septal deviation. I was diagnosed with septal deviation. My mom, if you're watching me, please type when I was diagnosed, but I think it was like 5 years old. Okay, so that's my two favorite technique. Balloon, simple and easy. If you ever been hospitalized, you know about insensitive spirometry, the little thing that they give you to inhale. It is better than the balloon, but it costs, the device costs about $500, and balloon costs, 10 of them cost $1. It's very similar, it's very close, it's very cheap, it's affordable to everybody. Everybody can do it. And this one does not require any equipment whatsoever. So this is two of my favorite that I'm doing for myself, and I'm recommending for all of my patients, and hopefully you can incorporate it in your life. And I'm giving floor back to Dr. Espinoza. What is your two favorites?
Okay, so I want to start with Incentivespirometer. First, actually, I want to start with nature knows best when it comes to Oksana, because if you know her and you know her energy and her spirit, she is all sympathetic. And so the importance of the nasal breathing is when we have flow, more flow through our right nostril, that's our more sympathetic nostril. Our left is more parasympathetic, which means the relax. And so she is resetting herself, it sounds like, to be more balanced there. But if you notice, and don't get alarmed if you notice at some point during the day or in the midst of being busy that you're only breathing out of one nostril, or at night when you're trying to relax, you're like, well, my right nostril is a little bit, it's your body just kind of resetting itself, because the sensors for sympathetic and parasympathetic are more pronounced in one and the other. So, and then let me launch into the Incentivespirometer. I love the Incentivespirometer. It's actually, I priced it out and I order them from my clinic every few months. They're $20 on Amazon. And so, you know, when my patients come in, I like to have one to hand to them for free, because it's a good way and it's a good maneuver to work that diaphragm as you would a bicep. And so my thing that I say with breathing has to be, it's a 50-pound dumbbell. And so what I mean by that is that you come to the gym and you see me have a 5-pound weight and I'll lift that up 20 times. You wouldn't be as impressed if you saw, as compared to if you saw me lift a 50-pound dumbbell. So it's all about that slow, you know, engaged movement of the diaphragm. So one of the things that I ask patients, if you don't have an Incentivespirometer, to basically inhale. Now you're inhaling through your mouth. You inhale and you keep that little white dial on, or the yellow dial, I'm sorry, on the side. Good, better, best. You actually have to hover it. So it's not just about that white dial, seeing how far you can go with your tidal volume. It's about hovering the little yellow thing on the side so that you're almost kind of, you're holding your breath in and really working that diaphragm. Another good, simple, easy way, a straw and a piece of paper. You take a straw and a piece of paper. It should be about like a not a flimsy piece of paper, but maybe what you call a note card. And you take the straw in the note card and see if you can inhale and hold that note card up for as long as you can, because you know you're engaging that diaphragm. That's one of the things that, you know, it sounds easy, but it's much more difficult than you think, but it really does work that diaphragm. The other thing is the smell the flower, blow out the candle. So when I'm observing people sitting there talking to me and they're talking, and then when they stop talking and I start talking, I notice that they're still breathing out of their mouth. I ask them to close the mouth, and we try to practice smelling the flower. So we're going to breathe through our nose and we're going to blow out the candle. So we're going to blow out through our mouth. And that's, you know, until you get to the point where you can breathe in and out through your nostrils as you should, that's a simple way to start training your nasal cavity to really be engaged in the inhalation. So those are really, I mean, I would say those are probably my three. If you have the Incentivespirometer, I like to teach it in clinic, but if you don't, the straw and the note card works. And then if you can remember to smell the flowers and blow out the candle, that's a good way to get that nasal cavity involved in the breathing breath work.
Wonderful. Thank you so much. And can you please post under this video, when we post it, can you please post a link for this Amazon, where were you able to find it for $20? Because when I order it through the insurance, half of the time it doesn't cover it, and then they try to charge my patients $500. Okay, so it's better probably not to go with the insurance at all.
Absolutely. And yeah, that was one of the first things. And it's pretty, there's different types out there, but anything through the insurance obviously is going to be sky high. But yeah, Amazon, anyone, $19.99. I'll copy the link.
Okay, well, do you want to add anything? I feel like it's a wrap. If you guys have any questions, we're here happy to answer any of your questions.
The last thing I'll encourage
Wait,
is try to breathe as
Dr. Espinoza, we lost you. The last thing you're going to try to
Oh no,
encourage
oh, I
people is
thought
to
there was
try
a
to breathe.
question coming up. Sure. No, the last thing I would add is to try to see if you can get outside and breathe fresh air. It's staggering the amount of people who say, you know, I'm always congested and I'm always, you know, post-nasal drip. And we think about the allergens that are concentrated in our homes or our cars. If we never get out and breathe fresh air, and the best is walking and breathing. Walking and breathing, you're getting outside, you're moving, you're getting good blood flow. That's actually that's the best combo. So breathing natural air outside.
I just had this wonderful thing that I recently read, and I just want to mention, in addition to you saying outside, so you know, I'm all about fulfilling all of your basic needs. And one of the needs, as every mammal has, is need for open space. So apparently when we sit in the cubicle, we never leave the house, our brain completely shuts down. We actually wired to need an infinity. Infinity meaning you're looking somewhere and you don't see anything except horizon, or you see the blue sky and your eyes don't stop anywhere. They actually proven it, unfortunately, on the prisoners, that if they are in solitary confinement and they see the walls, then they go absolutely nuts and insane. It's very unhealthy for our nervous system. And that's why even if you're in the prison, you have 2 hours per day when you outside and you see the clear sky. So I discovered through like reading this information that you need at least 30 minutes per day of infinity. And infinity can be forest. When you don't see the end, you think it's infinite. You can look at the sky are infinite. You can look at the Pontchartrain Lake. It's almost infinite because I don't see North Shore from Metairie, you know, or like, of course, water, like any beach. And you need to have 30 minutes of it per day, every single day. Otherwise, the nervous system is going to shut down after 21 days. So 3 weeks without
Wow.
infinity in your life and guaranteed to go insane.
Wow. Amazing. I
Okay,
learn
guys,
something
I
every day
think
from you.
we don't have anything. We don't have any questions. We are so happy you were able to join us. And again, Dr. Espinoza is my hero because she was super sick yesterday and we were discussing that we're going to cancel this event, and I'm so happy that she was able to join us and share all of her wonderful wisdom. And again, if you email us and you have any questions, we are happy to do any events, any educational stuff for you. Check out her Qigong, which is, again, guys, it's free. It's free for the community.
It's great.
So like, just come join her for the class, call her clinic. I'm gonna put the link to her clinic underneath this video, and we're gonna put Amazon link for
Yes,
Incentivespirometer. Well, thank you so much
absolutely.
again. I hope you have a
Thanks.
good day, healthy weekend. Take care of yourself.
Yay. Amen. And thank you. You're amazing. You're amazing. Thank you for this opportunity, but your knowledge and sharing of it so willingly. You're the best.
Love you too. Have a good day, everybody.